Στο πλαίσιο λοιπόν του εορτασμού της Παγκόσμιας Ημέρας κατά του Καρκίνου έχουμε ένα μήνυμα, ένα βίντεο από την U.I.C.C, από την Dr. Kirstie και παρακαλώ τους τεχνικούς μας να το προβάλλουν στην οθόνη.
Ladies and gentlemen, esteemed guests and distinguished participants, thank you for the opportunity to share this message on behalf of the Union for International Cancer Control, on the occasion of the 8th Annual Congress for the Hellenic Cancer Federation and on the eve of World Cancer Day 2024. A key day for all of us in our collective effort to advance cancer control in our respective nations and around the world. The theme of the Congress is person-centered cancer care, co-creating the framework. This theme speaks to the critical importance of the lived experience of all those affected by cancer through the meaningful engagement of patients, survivors, caregivers or families in achieving quality prevention and control of cancer. In accordance with the right to health, which includes the right of all individuals and communities to active and informed participation on issues relating to their health, the participation of patients in all health-related decision-making at the community, national and international levels is increasingly recognised around the world. The engagement of patients, survivors and caregivers in decisions that concern them is qualified as an indicator of health democracy. All along the cancer prevention and control continuum, people-centered approaches are key in ensuring the legitimacy, relevance and quality of all cancer policies. People living with cancer have a right to meaningfully take part in all policies and decisions related to their care. The pivotal role of cancer patient organisations as a vehicle for the sustainable representation of the patient voice and the collective experiential knowledge sharing in institutions and policies has also been increasingly acknowledged in recent years. Participatory approaches, with direct engagement of such organisations in policies, and particularly in the development and implementation of national cancer control plans, are key levers in implementing the right to health in cancer control decision-making processes. We'd like to acknowledge and applaud the work of the Hellenic Cancer Federation in bringing together and acting as an umbrella organisation for 45 cancer patient organisations in Greece. Cancer patient organisations are also an essential part of U.I.C.C.'s 1,200-strong membership, representing approximately 40% of our members. U.I.C.C. is committed to ensuring and supporting the growth and development of these organisations, and ensuring that these groups are engaged and heard as key partners in the cancer community and health systems, locally, regionally and globally. U.I.C.C. was delighted to see and support the launch last year of the new framework by the World Health Organization for the meaningful engagement of people living with non-communicable diseases and mental health and neurological conditions. However, much still has to be done globally to ensure the institutionalization of the meaningful engagement of people living with cancer in all policies. Now, as we mark World Cancer Day this year and the third and final year of the Close the Care Gap campaign, U.I.C.C. is calling on leaders to act to improve inequities in cancer control, to ensure that every individual has access to essential cancer services and receives the care and support they deserve, regardless of their socioeconomic status and without facing financial hardships. These gaps, often rooted in social determinants of health, create obstacles for many to receive reliable information and essential cancer prevention, treatment and care. This situation not only undermines public health, but also leads to higher costs for health systems, increases risk of late-stage diagnosis and lowers chance of survival. Where a person lives should not determine whether they live. This World Cancer Day call to action urges governments to increase funding for cancer research, develop a population-based cancer registry, implement an effective national cancer control strategy, take measurable action towards universal health coverage, and improve education around cancer. Strictly regulate the production, sales, and marketing of tobacco, alcohol, and other carcinogenic products. Implement routine screening programs for common cancers. Foster patient-centered care and address the systemic and social determinants of health. Please visit the World Cancer Day website to sign this call to action today. It is incredibly heartening to hear that there are national commitments in Greece to participate and prioritise the creation of a national cancer plan, establish a national cancer council, and develop a national cancer registry, as well as to foster patient-centred care, supported by discussions such as those taking place in this Congress. All of these are fully aligned with this call to action and are pivotal steps forward to improve cancer care in Greece. We stand alongside you as you work to bring these commitments to reality. In closing, I would like to wish you a wonderful 8th Annual Congress, taking this opportunity to share learning and experience, to encourage and motivate one another, and to explore how you can collaborate more effectively and in new ways to address the gaps in cancer care. Finally, thank you for your support for World Cancer Day. Together, we can make a difference.